Welcome to this edition of Legislative Report. I'm Anthony Tezak. This year, 795,000 Americans will experience a stroke. The more quickly medical care is administered, the less likely a stroke will be fatal or debilitating. Here to talk with us today about efforts to ensure stroke victims in Pennsylvania receive proper care, as well as giving us an update on the opioid crisis facing our state, is State Representative Ryan Mackenzie. Representative Mackenzie, welcome.
Hey Anthony, thanks for having me back.
And thanks for joining us again today. Why don't we start with the stroke issue? As we said, 795,000 Americans annually are going to suffer a stroke. And we know it's been proven that the more quickly medical care is administered, the more likely a person is either going to survive or have less long-term issues going forward. However, we know that victims in Pennsylvania sometimes aren't receiving proper care as far as being diverted to a hospital that may not be equipped to deal with the type of stroke that they're having. Why is this an issue?
Well, I mean, absolutely. Let's start out at the very top. Strokes, as you said, a leading cause of death in our country. But we do have great medical care in the Lehigh Valley and throughout Pennsylvania. We're very fortunate to have a lot of great hospitals and health systems that do provide excellent care for individuals who have a stroke. And what we're seeing is that because of the advances in technology, these individuals are actually surviving strokes more often and living perfectly healthy lives. However, if they don't get that care in the appropriate amount of time, they can face lifelong challenges. And if they don't get the appropriate care in an amount of time that's necessary, they obviously can face death as well. And so it's important that you get the individual to the right location in the shortest amount of time possible. And we have 81 stroke centers across Pennsylvania, but current law does not actually direct the EMS professionals who receive the individual in the field to get them to the nearest appropriate stroke center. The law, as it stands, it was put in place back in 2012, and at the time there was only one type of stroke center, a primary stroke center. And so the law said that you had to take the person to the nearest stroke center. Well, what's happened since 2012, the federal government has new certification and accreditation standards such that there are now 3 types of different stroke centers. So there are acute stroke-ready hospitals, there are comprehensive stroke centers, and then there are still those primary stroke centers as well. And so those different types of stroke centers can handle different levels of strokes and patient needs. And so what we're hoping to do is update the law, make it such that an EMS professional in the field can triage that individual, decide where to take them, and they can take them directly to the closest appropriate stroke center. Because what we're seeing is sometimes, we've heard anecdotally the stories where an individual gets taken to the nearest stroke center, and that stroke center says, hey, we can't handle this level of stroke, you need to go somewhere else. And again, valuable seconds and minutes have now been wasted, and that EMS provider might have to turn around and go back the other way, or they'd have to continue down, but they've already wasted some time. So again, a very important update to the law, and again, I've introduced that legislation. It's now gone through the House, and we're hopeful, even though it's the end of the session, that it will come back up again next session, of course, and make it all the way through the legislative process.
Hospitals are already certifying under the new federal guidelines. However, Pennsylvania isn't keeping up to allow them to receive patients as timely as they should, correct?
That's correct. And so this isn't going to be a new cost or a mandate on the hospitals that are out there. They're already complying with these different certifications. They've already self-selected, decided what level of care they can provide appropriately, and so they've gone to those different levels. Again, we just want to make sure that the EMS providers out in the field now have that information and can make a decision on their own. It's a very challenging thing being an EMS professional and having to make decisions like this in the field, but again, advances in technology have allowed that they can have a better idea of what type of stroke somebody is experiencing, even just in the field. And so again, if they can make that decision, get them to the appropriate level of care in the shortest amount of time, that's a real win for the patient.
And the legislation that you're speaking about is House Bill 2350, which you are the prime sponsor of. Can you tell us a little bit what went into crafting this legislation? You mentioned that 2012 was the first time any type of law was put into effect. where patients are going, and that was your first year in office.
Yeah, absolutely. Well, it's been a convergence of different issues. So about 2 years ago, I went over to Lehigh Valley Health Network on Cedar Crest. It's in the heart of the district that I represent. And they have a great stroke facility there. They do fantastic work. They're getting terrific results, and they're also doing some cutting-edge work there. And so I was able to go see it, experience what they were doing. They talked about the challenges they were facing. And at the time, we didn't yet have a solution, but we met with different stakeholders. We met with the actual doctors there from Lehigh Valley Health Network. We met with individuals from St. Luke's Hospital, from the American Heart, American Stroke Association, from all different EMS providers across the Commonwealth. So all different stakeholders were involved and included in this process. And this is also a story of how relationships come into play in government. So a former colleague of mine from when I worked at the Department of Labor and Industry is now at the American Stroke, American Heart Association as their legislative director. And so we had a great working relationship, worked on this language very closely together, and we were able to come up with House Bill 2350, again, something that a broad group of stakeholders has supported and gotten behind. And so really something that we're very optimistic about seeing passed into law next session.
And that was going to be my next question. I mean, as of the day of this taping, we're now on the last legislative day on the calendar.
Yep.
What is the prognosis for this getting passed?
It came out of, we had a House Health Committee hearing on the legislation, went through that committee unanimously, then also through the full House. And so really no opposition at this point. I think everybody sees and recognizes the need for this legislation. For us, it was just simply a matter of time that the legislation was ending, and so we will have to reintroduce it next session and start over on that process. But I think it has a very strong chance of getting passed very quickly in the next session.
Moving on to another healthcare issue is a issue that really is one of the biggest healthcare crises in the state of Pennsylvania that we've had in a long time, and that's the opioid and heroin epidemic. How big is this problem truly?
It's a huge crisis in our communities. I mean, you're seeing individuals who are getting more involved with heroin and opioids and doing so at a younger age, cuts across all lines you can think of: gender, race, socioeconomic classes. So I mean, really, anybody can be affected by this, and there are all different ways that people get involved in taking these types of drugs. And so it's a very challenging situation, but because of the cheap heroin that's on the streets and how it's being mixed and cut up these days, it's very potent, these drugs, sometimes mixed with some really bad chemicals like elephant tranquilizer, known as fentanyl, which can lead to death even the first time that you use this. So it's a really scary situation in our communities.
A lot of people we've heard through the various hearings held by the policy committee across the state is a number of these patients abusing the medications start and initially get addicted because they're being prescribed these opioids by doctors for issues that maybe aren't necessary to be given this strong medication. However, you've introduced legislation to try and correct that. Can you tell us a little bit about it?
Absolutely. So the House Policy Committee, which I'm a member of, did hold hearings over the past summer. Went around the state, heard from lots of experts on this topic. And first off, there's no silver bullet. It's going to take a multi-pronged approach. We're going to have to attack it from all different angles. But you are correct. One thing we heard was that people are getting overprescribed. I mean, that's the main problem that we see here. And so specifically, as a member of the Labor and Industry Committee, I deal with workers' compensation. And we found study and data has shown that in Pennsylvania, we are in the top 3 in terms of overprescribing opioids for injured workers. And when you look at that in the dosage amount, it's I think 78% higher than the median average of all states. So, I mean, significantly higher. And so this is something that we need to rein in. And I have introduced legislation on this topic as well, which would put in place guidelines for doctors to adhere to in terms of the types of drugs they can prescribe to injured workers, the dosages, the durations, and we found that that guideline system has gotten great results in other states in terms of bringing workers back to work faster and doing so with the appropriate medications.
And very quickly, you mentioned you member of the policy committee. How important was it for the policy committee to have these hearings across the state?
Yeah, I think it was very important, very informative. We were able to actually hear from a broad range of stakeholders who were involved, not only in the prescribing, so from medical professionals and doctors themselves, but also in treatment, in recovery, in terms of education. So again, so going to take a multi-pronged approach, but you see that there are all these different areas that an individual goes through when they start getting involved in these types of drugs, get addicted, and have the complications from that addiction. And so how you work through and can help individuals who are at all those different points. Obviously the education and over-prescribing can stop somebody from getting addicted in the first place, but then once they are addicted, what can you do to help the individual? So it was great in terms of helping understand the broad spectrum of issues that are involved in this.
We only have 20 seconds left, but if someone at home watching has a family member that they know or think may have a problem, where can they call to get help?
Yeah, so we do have information here for in Lehigh County. They can contact the Lehigh County Drug and Alcohol Administration. That phone number is 610-782-3555. Again, 610-782-3555. In Berks County, you can contact the Council on Chemical Abuse at 610-376-8669. Again, 610-376-8669.
All right, Representative Mackenzie, thanks for joining us. Two very important issues facing the state right now, and it's good to see that you're at the front of both of these issues.
Well, thank you again for having me, Anthony.
It's all the time we have for today's program. If you have questions about today's topic or need assistance with any state matter, please contact Representative Mackenzie at his district office or through his website. That information will be shown in a moment. Thanks for watching, and please join us again next time for another edition of Legislative Report.